Now, what is asthma as far as definition is concerned? Asthma is a heterogeneous disease characterized by chronic airway inflammation. So, airway inflammation is a key point in asthma. So, it is defined by the history of respiratory symptoms such as wheeze, shortness of breath, chest tightness, and cough. All symptoms vary from time to time with the intensity and from individual to individual. And the airflow limitation is variable as far as all these factors are concerned. So one should know definition of asthma very well. If we see in this slide, on left hand side we see the normal bronchiole, and on right hand side we see the asthmatic bronchiole. So asthma is characterized by narrowing of the airway, constriction of the muscles of the airway, and inflammation. So these three factors are very, very important. How to diagnose asthma? It is very simple, very easy. On the contrary, I will say majority of the patients, they come with the diagnosis. They will tell you, doctor, I got asthma. Doctor Sahab, I got asthma since these many years, and now you give me the treatment. So don't believe each and every patient on his or her diagnosis. So diagnosis is dependent definitely on history, evidence of variable airflow limitation from bronchodilator reversibility testing or other tests. So this reversibility is very, very important. One thing is that patient will come with these symptoms with seasonal variation, with diurnal variation. There is some association, or they will tell you that I get these types of symptoms when I expose to particular type of the food or weather change, or so many things which I am going to discuss later on. On physical examination you will get wheeze, but wheeze is not present in severe asthmatic patients. Friends, remember well, when a patient comes with asthma with severe symptoms, the chest could be very sagging. Patient with respiratory symptoms, when they come to you ask a question whether the symptoms are typical of asthma. And as we have discussed, if they are yes, then you have to go for the detailed history, detailed examination of the patient. And if this examination finding, this support for the asthma. Now again, asthma could be associated with COPD, that is asthma COPD overlap syndrome. Patient could be having barrel-like chest. They might be using accessory muscles. So these findings will be there, and definitely sometimes when you ascal the chest, there are bronchi, but majority of the times symptomatic patient will come with audible wheeze. Now what you have to do is, you have to do a pulmonary function test. So you perform PFT, that is pulmonary function test, and in this PFT, in this pulmonary function test, friends, reversibility test is very, very important. What is this reversibility test? First, patient has to perform the pulmonary function test without any bronchodilator. Take the readings, measure the readings, record the FEV1. Later on, you give the bronchodilator, perform the test again, and see whether there is improvement in FEV1. So bronchospasm is reversible with bronchodilator drug, that is called as reversible test, and yes, that is the proof for asthma. As we are going to discuss regarding the types of drugs, one is reliever drug and another is controller drug. Now what reliever drug does is it dilates the bronchi. So reliever drug, when it will act, you can see in the first half of the slide that airway narrowing becomes reversible and airways become broader or they are dilated. Now what are the Effects of controller drug. The controller drugs, they act on inflammatory part and they act as anti-inflammatory, and they will again help airways to become dilated or narrowing becomes less. Controller drugs are inhaled corticosteroids, and reliever drugs are long-acting beta agonists. They are LABA. So ICS and LABA, controller and reliever. So they help each other by acting on two different key components: inflammation and bronchoconstriction. So these drugs, they help to control asthma in a better way for a long duration.